Effects of 8-week supplementation of ashwagandha on cardiorespiratory endurance in elite Indian athletes. Cycling is an endurance sport that is often accompanied by superior endurance physiology. Years of endurance training, aided by a favorable genetic disposition, yields a series of physiological adaptations designed to maximize endurance performance by increasing the amount of oxygen which can be delivered to and utilized by working muscles. An ergogenic aid is a technique or practice that increases the performance capacity, efficiency to perform work, and ability to recover from exercise, therefore creating greater training adaptations. Ashwagandha has been an important herbal medicine for well over 3,000 years, and its root contains flavonoids, alkaloids, and steroidolactones, which help in a variety of musculoskeletal conditions as well as increasing energy and improving overall health.
Study consisted of 40 elite cyclists from the Punjab region of India who were between 18 to 27, have at least one state-level competition medal, and were not tied to any dietary supplements or ergogenic aids. Subjects were split evenly between an experimental group who consumed ashwagandha capsules and a placebo group who consumed a starch capsule. The study was conducted over an 8-week training camp. The subjects performed 2 graded exercise tests until volitional exhaustion. One test was prior to the 8-week training camp and one was after the training as an assessment of potential change in VO2 max. The intake of the ashwagandha supplement was 2 500 mg capsules per day for each subject, one in the morning and one in the evening, totaling 1,000 mg per day.
Out of the 2 groups that took the supplement, only the experimental group showed improvements. The placebo group showed no changes in respect to their baseline parameters. There was no statistical differences in the baseline data of the 2 groups in regards to age, height, weight, BMI, gender, and VO2 max. The experimental group showed an increase of 13% in their post-test results of the VO2 max, improving from 46 to 52 milliliters per kilogram per minute. This statistical increase shows the potency of the ancient herb. Subjects also show significant increase in their time to volitational exhaustion and metabolic equivalents. Fatigue in cycling is attributed to different factors including and not limited to thermoregulation, psychological factors, and cardiovascular endurance. The post-test time to exhaustion in the experimental group went from a 10.7% increase in time in the male subjects compared to a 4.3% increase in time in exhaustion in the female subjects. This shows ashwagandha to have proven anti-fatigue abilities.
After the treatment, the experimental group showed an increase of 13% in their VO2 max, while the placebo group did not show an improvement after the treatment. So this statistical difference verifies the effects of ashwagandha, but the researchers indicated that they could be due to other factors, such as an increase in red blood cells or hemoglobin that past studies indicates that this medication has. And finally, we saw a much bigger effect in males than in females, and this is probably due to endocrine differences between the 2 sexes.